Thank you once again for inviting me to take part in this oral interview on your platform. Um, I received the questions you shared with me, and I will be answering them one after the other so that there is chronology and you can easily understand what I'm saying. So, when you contacted, you wanted to know who Tumenta NS is. Tumenta NS is a Pan-Africanist. He is pushed by the Pan-African spirit to bring uh, his own contribution into the development of the continent. And though not being a healthcare professional, he finds a lot of interest in healthcare, especially in rural communities and for the deprived communities in Africa. And he has been able to pull a lot of energy and force around him, which led to the creation of his organization. He started first in his community with Vungo Center for Youth Empowerment and Development Center, where he had to be contributing to community development. And at the level of the community, he holds several positions of responsibility as far as community development is concerned. So, just to give you a highlight of what who Tumenta NS is. So, now your second question was to know what Panafi is. Panafi is the abbreviated form of Pan-African Health Initiative, which is a non-governmental organization, a not-for-profit organization whose principal driving force is to bring quality healthcare services to rural Africa and to rural communities. So this dream started late 2017, and because of thanks to the collaboration of other members and friends, relatives, and close collaborators, we were registered officially in Cameroon in 2018, February 2018, and since then we have been on the forefront as far as healthcare services in rural communities is concerned, and we have been trying to put in our best to make sure that our mission and objectives are attained. So, your third question, you wanted to know what the mission of Panafi is. Thank you very much for this question, and I think it was a very necessary one for me to just let the people know, your audience get to know exactly what our mission is. The mission of Pan-African Health Initiative is to see that all African communities and people have access to quality. I emphasize on quality, effective, and efficient healthcare services within a developed healthcare system. So that is our mission. That is what we hope to achieve. Now, if I was to go on to sleep one night and just wake up and see this dream I realized, then Panafi has come to the end of its journey. So we keep fighting until this is achieved. Now, the mission of Panafi, which will also lead us, this is more like a pathway leading us to the vision, is Panafi seeks to collaborate, that's work with community leaders, civil society organizations, the international community, local and central governments, and to provide quality healthcare services to all African communities, especially the disadvantaged areas in Africa. Yes, this is what we stand for. This is what we hope to achieve. Okay, this is how we hope to achieve our goal. And now, you also wanted to know our main areas of focus. It's true. It's very true that listening to all what I've said so far, I mean, people will be asking questions. But what's our main area of intervention? We hope to intervene in every area of healthcare. Okay, because improving healthcare is not about just about improving a particular sector of healthcare. However, looking at how vast healthcare is, especially in rural communities, we have selected 5 priority areas which are not static anyway. As we change our strategic plan, we change our area of intervention such that we get to touch every area of healthcare. So for the first few years of existence, we are focused on 5 main areas, which the very first one was is the health, HIV and AIDS. That's HIV and AIDS, tuberculosis and malaria. These are this is the area which continue to take away tons and thousands of lives of Africans. So we continue to fight in this area to make sure that we bring these services to communities. The second area of intervention is family health, and family health has been grouped has been coined to harbor 5 other areas of intervention, which is mother and child health care, you have adolescent health, family planning, sickle cell management and education, and then we end up with general counseling. Now, the third area of intervention is community outreach and research. The fourth being disaster management and emergencies, which includes conflict, disaster outbreak, and emerging diseases. The fifth area is environmental protection and sanitation, which is water and sanitation, nature and environmental protection. Now, you went ahead to ask a very a question which I always like to talk to people about. What projects have we implemented since our journey in 2018? It will interest you to know that we have been able to pull a large crowd continent-wise to host the Pan-African Health Conference, PACON, whose first edition took place in Cameroon in 2019, in Yaoundé precisely, and we had a lot of collaborators where we collaborated with so many organizations. Here I think of organizations like the Teaching Artists Institute, I think of the Global Medical Libraries. These are organizations that stood with us. I also think of Big Step Africa. When we were realizing this dream, it was quite good. We had supporters from all these organizations, and this is a yearly conference which is supposed to be, it is very dynamic, okay, holding in several African communities. So it started in Cameroon, moved to Nigeria, despite the fact that the conference in Nigeria was heavily affected by the coronavirus, which we could not bring together a large crowd. However, we are looking forward holding that conference again sometime this year, God willing. And we have also been able to to start up and develop our Panafi counseling service, whose mission, whose main objective is to bring quality mental health care services to Africans wherever they are located. And this service will interest you to know that we provide our services both online and offline, so people get to benefit from it. One of the main service we provide to general public now is the service of the mental health evaluation, where you know your depression state standards, you know your stress status, and you know your anxiety level. So you do that evaluation, and we give you your answers and response instantly. The very next level, the very next activities we have provided several online sensitization campaigns on malaria, salt reduction, industrial fat burnout, and so many other activities online. So we have also carried out a series of sportive works, especially in Cameroon, Yaoundé to be precise, and Zimbabwe, and all of that. So the works in Zimbabwe was heavily accompanied by sensitization campaigns where we participated in several cleanup campaigns in town and all that. So the next activity we were also involved in, we organized a seminar in Nigeria where we talked to the people about sexual and gender-based violence. We were so much interested in bringing down the rate, and thanks to the community volunteers we had, their efforts are yielding fruits because we are getting reports of the reduction. We also carried out massive campaigns, physical and online campaigns about the coronavirus, and in so many other countries where we shared, in so many communities where we shared hand sanitizers, some buckets for hand washing and soap. You also wanted to know how can someone contact a Pan-African Health Initiative. For now, we have, like I said, we have 3 functional countries who are legal. We have a legal status in these 3 countries, being Zimbabwe. We have Zimbabwe with the country director and his team, which I appreciate them for the work they are doing. We have the team in Nigeria, which they are doing their work. The team in Zimbabwe is headed by Neva Dodo, and the team in Nigeria is headed by Rustom Alexandra, and he is doing a marvelous job together with his team, his entire team in Nigeria. We appreciate their efforts. And in Cameroon, the team is headed by Abo Charles, and he's also doing a marvelous job. Cameroon being the continental headquarters, we are making steps towards that. And you can easily reach out to Panafi by email, panafi@gmail.com, or you use our office, which is located in Aqua, Carrefour Ano. You can also reach out there. When you get there, you can also give. It's better you send us an email, and we can easily direct you and give you exactly the location where we are. There you can find us. Okay, you wanted to end by knowing what are our sources of income. So far, it has been very challenging getting funds from donors. Okay, however, we put in our efforts from our members who have not relented their efforts to always chip in financial assistance, volunteering their funds, sacrificing a lot to make sure that we get to realize our activities. So our major source of income has been our members, and the second source of income has been coming from those who volunteer to participate in activities like the health conference. We had people who paid to register for the conference financially and also showed up. We also have a source of income, motivation. Okay, this resource is a very important one. We have motivation from the society who constantly come back to us with words of gratitude. Okay, and we are also very satisfied. That satisfaction pushes us to move ahead even when we do not have the resources to implement our activities. So I want to use your platform to say our doors are open to donations that come in from anybody who wants to make a donation. You're welcome, and know that 100% donations that come into us will be tilted towards project implementation. Thank you very much, and just to let you know that Pan-African Health Initiative is always open to participate in your debates and your questioning, your seminars. We are always very, very ready to participate and share with you, and we are also open for partnership. Thank you very much, and have a good day.